Wisdom tooth extraction. This is a common surgical procedure where one or more wisdom teeth, located at the back of your mouth, are removed. These teeth, also called the third molars, usually come in between the ages of 17 and 25 and are the last teeth to emerge. Have you ever had a wisdom tooth removed, or do you still have yours? Share your experience below. In some cases, there simply isn't enough room for wisdom teeth to grow normally. When this happens, they can push against other teeth, causing severe pain, swelling, and even complications like infections or crowded teeth. If your wisdom teeth are causing problems, your dentist may order an X-ray to evaluate the teeth and surrounding nerves before proceeding. Once it's clear the teeth need removal, the dentist will disinfect the area and determine the best type of anesthesia for the procedure. Please subscribe to this channel. This helps me a lot. To remove an impacted wisdom tooth, the dentist first numbs the area and then makes a small incision to reach the tooth. Using specialized tools, the dentist carefully sections the tooth into smaller pieces, making it easier to extract each part with minimal impact on surrounding tissue. Once the tooth is out, the dentist may clean the area and possibly place a filling to prevent infection. In some cases, they'll stitch the wound, with stitches usually removed about a week later. Full healing of the bone and tissue, however, can take around a few months. After the procedure, please follow your dentist's instructions. If swelling occurs, you can apply an ice pack to your cheek near the extraction area. But if discomfort persists, reach out to your dentist. Thanks for watching, and if you found this helpful, don't forget to like and subscribe for more health tips.